Okay, before we get into the content for this week, I wanted to make a couple of comments. First, I'm going to be posting a survey on the course website asking you for some feedback on how you think the class is going and what suggestions you have for change. Please take the time to give me some feedback. I take your comments seriously and will do what I can to address the concerns that you may have. These surveys are anonymous. I don't know who is giving what suggestion or information, so any ideas you have, please let me know. Second, I also want to take a few minutes and go over the group project. The first group that I select will be receiving their group assignment this week. I'll be sending an email for the class on substance abuse and race and ethnicity. So just to review, I want you to do a PowerPoint presentation in your group that will be posted to the website for the assigned week. In essence, your group will be providing the lecture for that week. You have a month to complete the presentation, and I'm asking that you turn your presentation in a week before the content is to be posted so that I have a chance to review it. Your presentation should be about 12 to 15 slides, and don't forget to find 3 to 4 websites that will also help your presentation, and put notes on the bottom of the slides. Many of the groups in my previous classes didn't use the notes feature and crammed as much information onto a slide as possible. That made it very difficult to read, so it would be better to use bullets to highlight the main points and use the notes feature to more fully explain your point. Use my PowerPoint lectures as a guide for how to proceed. I'll be setting up a discussion board topic in your small group for you to exchange ideas on your topic, on your project, and I will also set up a virtual classroom for each small group so that if you want to meet and have a live chat, that will be available for you as well. Get in touch if you've got any questions along the way. Okay, so this week we're going over prevention of drug use and drug abuse. I think when most people think about prevention, they generally think of the DARE program, or the Drug Abuse Resistance Education Program. DARE is a favorite of those who don't know any better, and I say it that way because in general there are lots of studies that have suggested that DARE does not work to prevent drug use, but it keeps getting lots and lots of funding. There are some beneficial short-term effects, but in the long term, DARE graduates have the same level of drug or alcohol use as the kids who don't go through the program. Now, to be fair, the folks who write the DARE curriculum have been working lately to respond to those criticisms and update what they do. It's a work in progress, and we'll see if it makes any difference in the future. There are also programs to reduce the harms associated with substance abuse. This is an approach called harm reduction. Examples of these types of programs might include syringe and needle exchange programs or teaching teens skills to drink responsibly rather than abusively. As you can imagine, these programs can be quite controversial because they move away from the just say no philosophy. So get in touch if you need anything, and I'll talk to you again next week.